Picture this, a typical day in your life. Everything is seemingly fine. Nothing is out of the ordinary. Then, someone makes a comment, or a facial expression, or anything that might trigger you, and in the blink of an eye, you can't breathe. If you're sweating profusely, your heart is pounding hard enough to climb out of your chest. You feel like you're going to scream and sob and die all at once, and sometimes you don't even know why it's happening. If you're sitting on a train or in a classroom or behind your desk at the office and it happens, you have to try to suppress it so no one gets alarmed. Space so you can let it come full force, so your insides don't explode from holding it back. When you're alone and triggered, it's just as terrible. There's no one stopping you from screaming or sobbing, or doing something horrible to yourself in a desperate attempt to make the pain go away. I've learned through the years of these incidents that letting the panic attack take its course is probably the worst way to handle it. You think in the moment that by crying and screaming for a few minutes, you'll feel better. In fact, it does the opposite. By submitting yourself to the panic attack, it gives it the power to grow and become stronger and more intense. It's a bad situation to be in, and have them on a daily basis. Anxiety is one of the most common sensations that humans experience, yet it can be detrimental in severe doses. Anxiety has helped us as a species survive thousands of years through keeping us hyper-aware of our surroundings, to avoid danger and be on our toes during an emergency. This means that now there are those individuals that experience anxiety at every little aspect of life. I am grudgingly happy to admit that I am one of those individuals who experiences way too much anxiety, and therefore has what psychologists like to term a panic disorder. One of the hallmark signs of some of the highest levels of anxiety is a panic attack. Panic attacks are, at least for me, one of the most horrible things that a person can experience. If you've had a panic attack before, you'll probably agree. Panic attacks are terrifying. The best way I can describe my panic attacks is one of those heart attack scenes from every single medical drama there is. It's much worse than sweaty palms. Your entire body starts sweating. Sometimes things become cold. Whenever I'm at my worst, my breathing becomes so rapid that my throat hurts. Noises come out of your throat without your permission, and you don't even recognize them. I get the urge to drown in the panic and submit myself to the pain and terror that comes with it, which is the worst way to handle it. You're fighting with your mind and body to calm down when you don't even know why you're panicking in the first place. Like I said, one of the worst experiences ever. I've gone to various psychiatrists and therapists and psychologists who had all come to the conclusion that I have generalized anxiety disorder. They threw me on an antidepressant to help. As my panic attacks became more consistent and stronger despite the antidepressant, my doctor re-examined my condition and changed his mind. Panic disorder. The first time I heard those words, I felt like a freak. GAD is something a lot of people experience, so it wasn't that scary for me to deal with. Panic disorder sounds like something a crazy person would have, and I felt immediately ashamed by the label. At first, my doctor upped the dosage of antidepressant as high as it could go, but it didn't help. It only made me want to sleep 24/7. So reluctantly, I was given that small peach-colored pill called Xanax. It was a hard decision on both ends because Xanax is a known narcotic, and my family has a history of drug abuse and alcoholism. I was terrified about becoming addicted. We agreed to give it a shot because it was a great solution for most people in my position. Keyword, most. I took it a handful of times when I felt a panic attack coming on, but it just made things worse. I felt like I was drugged. I went from being super high-strung and panicky to super relaxed physically and very slow mentally. There was one time that I was panicking because I had a big presentation that afternoon and I needed to both finish it and rehearse it that morning. So I took a Xanax, and immediately my body went into stoner mode. I wanted to sit around and do nothing, but my mind was still racing through the drugged out mindset I was in because I knew that I needed to get this done. In the end, I wound up drinking 3 cups of coffee in the span of half an hour. The combo of the pill and the coffee helped me get through that day. But after that, I went to my doctor and told him how Xanax made me feel stoned, and how it made my attacks worse, but in a different way. He tried lowering the dosage, but I still had the same problem. Finally, he took me off Xanax and put me on its sister drug, Klonopin. The best way to describe Klonopin is that it's a slower reacting Xanax. It does the same thing, calm your mind, relax your body, help panic attacks from occurring. But instead of the onset time being around 5 to 15 minutes, like Xanax is, it takes about half an hour. Klonopin was a lifesaver for me. Because the onset time was longer, it meant I had to learn how to deal with the start of the panic attack on my own, but it slowly helped it go away a lot faster. Since the drug spat out its components over the course of half an hour rather than all at once, it helped me learn to calm down and breathe through it. Through the help of Klonopin and therapy, I have also learned the art of meditation. I found that when I feel a panic attack coming on, I take a Klonopin and then stop what I'm doing and focus on my breath. Inhale, exhale, exhale is the mantra that repeats constantly in my head. If my mind starts to wander or I start to worry, I notice it and without judgment bring my attention back to my mantra. I make it a point to notice my body, see what parts are tense, and purposely relax them with each exhale. I'll go up and down my body, starting from my forehead and ending at my toes, relaxing each and every muscle with every exhale. This helps my panic attacks go away even quicker, and over time, I've become so good at meditating that most of the time, I don't even need to take Klonopin anymore. If I feel an attack coming on, I'll stop what I'm doing and meditate. If I feel like it's a big attack or the meditating isn't helping, then I'll take one. But, as I'm afraid of addiction, I'll try to calm myself down. Without the initial use of Klonopin, I would have never gotten to the point where I can now stop my panic attacks on my own. It's been a long journey, and even though panic disorder doesn't have a cure, it's easy to forget if it's under control. When you have a panic attack, there's an obligatory feeling of doom. Everyone who has a panic attack has probably felt it. But despite that feeling, the world isn't going to end after or during a panic attack. Life goes on, and because of it, I've been able to make some form of peace with my mental illness. Do not let the stigma against antidepressants or benzodiazepines like Xanax or Klonopin, or the stigma of your mental illness label stop you from getting help. Although going on medication for a mental illness is scary, it does not have to be forever, and it definitely will not change who you are as a person. Mental illness changes who you are, and medication is the way to bring yourself back to normal, to give your brain the neurotransmitters it needs to function correctly, and it will help you be able to potentially cure yourself, like I have through meditation. Finding ways to harness the anxiety like some people can to focus during a speech is essential for someone with panic disorder to heal. It's a rocky road, and things don't always work on their first try. But one thing I've learned about people who suffer from panic attacks is that they're the most resilient people in the world. Even though hope seems lost sometimes, the people who suffer from the worst always find a way to grab hope by the horns and make a better future for themselves. For all of you who suffer from panic disorder or other similar mental illnesses, or just those of you who experience panic attacks, know that you're not alone and that you can get help. Thank you for watching Psych2Go. Subscribe and comment below if this story helped you, or
Okay, good morning. February 25, 2022. We will be discussing anxiety disorders as a continuation of what we have been discussing yesterday, your introduction to anxiety and anxiety disorders. Today, we will be focusing on two diseases, okay? Generalized anxiety disorders and for this, okay. Our target topics for this chapter is to be able to understand the effects of anxiety, neurobiological theories for anxiety, how anxiety disorders impair functioning, risk factors and proposed cures for anxiety disorders, risk for suicide for those with anxiety disorders. So if you go to Facebook now, you can see the post of Ma'am Paula regarding their patient. I'm not sure if it's in Atok or in Bontok, okay, who tried to commit suicide. Risk for suicides for those with anxiety disorders, assessment and interventions for patients with anxiety disorder. Since this is a recorded video and there are no students, okay, we'll just be going through the slides. What are the causes of anxiety disorders? We have defined yesterday what is anxiety. Okay, now we will focus on the disorder. Anxiety disorders are thought to result from a combination of genetic, biochemical, neuroanatomic, and psychological factors. Plus, of course, the patient's experiences can also contribute, okay, to the anxiety disorder. Anxiety disorders are often accompanied by other psychiatric illnesses, especially mood disorders and substance abuse, as well as other medical disorders. What are the factors? So what are going to be in play here are the theories that we have studied in the beginning, in the prelims of our subject. So what are the factors to anxiety disorders? Neuroanatomic factors. So it talks about your anatomy, okay? Your structures in your brain, your CNS. So MRI, magnetic resonance imagery, PET, positron, and EEG, electro, have identified brain atrophy, okay? Decreasing in the size of the brain, and what we call this, hardening of those parts of the brain, underdeveloped frontal and temporal lobes, amygdala abnormalities. So this have led to these findings they were able to see in patients with anxiety disorders. For biochemical factors, neurotransmitter imbalances may contribute to anxiety disorders. Okay, so what are your neurotransmitters? Serotonin, dopamine, norepinephrine, glutamate, and GABA. Okay. Also, factors that can lead to anxiety disorders are your genetic factors. Research show that some anxiety disorders are inherited. So many of them, including panic disorders, OCD, generalized anxiety disorders, and major phobias run in the family. So if your parents have anxiety disorders, most likely the children will also inherit it, just like your physical diseases. Okay, if your parents have hypertension, diabetes, okay, most likely you will also develop disease. Other factors that were identified in the book are your neuroanatomic factors. The same. Traumatic factors, traumatic events. PTSD is triggered by traumatic events. Can also be associated by separation or loss. Phobias can also be learned from parents. Okay, so if the child sees that the parents are afraid of insects, afraid of dogs, okay, so ayaw nila mag-alaga ng dog sa bahay kasi they're afraid of dogs. So they call this, the children can learn to be afraid of dogs as well, and be excessively afraid of insects as well. Okay, so it depends also. Okay, phobias can be learned from parents. Psychological factors. Anxiety disorders arise when the defense mechanisms become overwhelmed and dysfunctional. Imbalances by the ego due to interpersonal conflicts. So those are your psychological factors. Other factors that can lead to anxiety disorders. Hyperthyroid conditions, so abnormality in your thyroid functioning and thyroid glands, thus abnormality in the control of your hormones. Okay, so can lead to anxiety disorders, adrenal disorders as well. In terms of risk factors, okay, for anxiety disorders, the female gender is more prone to developing anxiety disorders compared to the male. Okay. Physical comorbidity. So a person who has a physical illness, if, for example, the patient has heart problems, lung problems, physical disability, okay, so it predisposes him to have anxiety disorders. Okay, so laging kinakabahan because of a heart condition, or this is anxious and stressed because the difficulty of walking, okay, because of an accident, okay, na-amputate yung isang paa niya, or na-amputate yung limb niya, yung arm niya. Okay, so it will eventually lead him to possibly developing anxiety disorders. Comorbidity also with other psychiatric disorders, depression, okay, can further lead you to have anxiety disorders. Okay, we want to differentiate fear, anxiety, worry, and panic. Okay, so not only for ourselves, okay, to distinguish what we are feeling, but of course, what is our patient feeling as well in terms of our assessment. So here are some basic terms. Fear is a response to an external stimuli. So there should be an external realistic stimuli. For example, a dog chasing you. You can see robbers in the window. May mga magnanakaw na hindi mo kilala yung muka. Okay? Nasa loob ng bahay nyo. Okay? Or outside the window of your house. You can see them chipping on your window, trying to open your window. Okay? Those are external stimuli. An announcement that there will be an exam. Okay? So that can be your stimuli. Okay? So fear is a response to a external stimuli. Compared to anxiety, anxiety is a response to an internal conflict that may influence behavior or even after cause an anxiety, after the anxiety is removed. Okay, the anxiety is still there. So what is the internal conflict? Internal conflict can be like you are thinking of what you want, your ego and superego. You're thinking that you want a new cell phone, okay? But the conflict is that you do not have the money or you do not want to work for the money. Okay, so there is a conflict with what you want and the reality of how you are getting it, but it is all internal. Okay, anxiety is caused by you wanting a higher grade, but you are lazy. I don't want to spend time doing it. So there is a conflict. I don't spend time studying. So there is a conflict already within you. That is your internal conflict. Worry may include anxious misery. Okay, so what do you call this? So it is apprehension, expectation, catastrophic thinking, and obsession. So you are thinking, overthinking about something. Okay, it includes we call this thinking about what can happen in the future, thinking about obsessions. Obsessions can be a crush. Okay, you are obsessed with an actor, an actress. Okay, and worrying how you are going to meet that person. Okay, that is worrying. Panic is an extreme level of anxiety characterized by a sudden overwhelming of terror and impending doom. So when you talk about panic, okay, this is what do you call this? Overwhelming feeling of terror. The patient is very afraid. The patient is having impending doom. Okay, so Wilma, today is nag-log out na. Okay, today is a holiday. I am just recording this and eventually I will be uploading it as well. So you don't have to be here. Okay, so it's okay if you log off. Okay, so panic is a sudden overwhelming feeling of terror or impending doom. Okay, what's missing here is sometimes it is unrealistic. Okay, the person thinks about dying, but there is no realistic proof that someone is out to kill her or there is a physical condition, medical condition that she is going to die. Okay, which we will discuss later. So we should be able to differentiate what is fear, what is anxiety, what is worry, and what is panic. Okay, the first of the two diseases that we are going to discuss for this morning is your panic disorder. Okay, panic disorder is anxiety in its most severe form. We remember that anxiety is normal. As discussed yesterday, it is the stress or the conflict that drives us to move. If you're anxious about how you look, what happens? You tidy up. Maligo ka, mag-makeup ka, you brush your hair, brush your teeth. Okay, wear clothes that are attractive. Okay, so it moves you to move. But panic disorder is anxiety in its most severe form already. Okay, so what happens during panic disorder? Okay, it is severe anxiety and its peak intensity happens around 10 to 15th minute Okay, it lasts for around 15 minutes. Tapos, it peaks at around 10 to 15 minutes. Okay? Rarely lasts more than 15 minutes. In this disorder, the patient has recurrent unexpected panic attacks that cause intense apprehension and feeling of impending doom. Okay, so what is happening here? Okay, there is a feeling that something bad is going to happen, but he doesn't know where it's going to come from. Okay, so if you watch the movie Final Destination, for example, they knew that they were going to die, but they don't know how it was going to happen. Okay, so it's the same with our patients here. There is a feeling that is threatening, but it is really unclear how it's going to happen. So there is a fear, severe fear of impending doom. Okay? When the patient is not having a panic attack, so between the panic attacks, the patient persistently worries about having additional panic attack. So wala na yung panic attack, okay? The patient is not currently having a panic attack, but the thoughts are focused on worrying. Nako, magpapanik na naman yata ako. Okay? So there is no panic attack happening yet, but the patient is focused on worrying about the next panic attack. So basically, parang tuloy-tuloy. Okay? It is a continuous panic and worrying, what is happening here. So that is why it is called a panic disorder. Panic disorder also, what do you have to understand? There is a high risk for suicide. As I said, just like the patient that Ma'am Ediva just handled. Panic attacks and a diagnosis of panic disorder are related to a high rate of suicide attempts and suicidal ideations. Okay, so they attempt suicide or think about suicide. Why? Because it is difficult. Okay, it is, what do you call this? It's like hell for them. Others describe it, it's like dying already. So I'd rather commit suicide. Why? Imagine yourself caught up in a cycle of having a severe panic attack, severe anxiety. Then after that panic attack, you end up worrying about the next panic attack. In the cycle, okay? Have a panic attack. Next stage is you calm yourself. After calming yourself, you tend to worry again about the next panic attack, which leads to the next panic attack again, then over and over again. So sometimes they just want to commit suicide because they're afraid, they're tired of being afraid. Higher likelihood of suicide and suicide attempts. The risk further increases in patients co-diagnosed with mood disorder, personality disorder, or alcohol abuse. So you have your comorbid conditions. The patient has a mood disorder, the patient has a personality disorder, or abuses alcohol, tapos meron pa siyang anxiety disorder. So what happens? It can further increase the chances of attempted or successful suicide. What are the causes? 18 to 41% have first-degree relatives with the disorder. Okay, so your anxiety disorder, genetic. Okay, it's a genetic factor. It is a gene or a makeup in your body that you inherit from your parents or from your grandparents. So mataas, lalo pag umabot ng 41%. Biochemical abnormalities in your body, your catecholamine system, okay, which is the system that produces your neurotransmitters, epinephrine, norepinephrine, GABA. Okay, so the neurotransmitters that we discussed yesterday. So if there are abnormalities in your catecholamine system, catecholamine system, okay, so it can lead to panic disorders and anxiety disorders. If we use the cognitive theory, okay, it tells us that anxiety or your panic disorder is a learned response. Okay, so in the environment that you were raised, in your family, okay, probably your parents or the persons who raised you exhibited behavior, okay, that was always panicky in appearance or anxious. Okay? It was an anxious environment. So what happens is when you grow up, okay, when there is a stimuli, that is also how you deal with the stimuli. You're very anxious, or you're having a panic attack. So it is a learned response if you use the cognitive theory. Another cause of panic disorder, according to the psychoanalytic theory, are your failure to resolve early childhood conflicts. Okay, so what are early childhood conflicts? Masyado kang napapagalitan, for example, father or mother mo. Okay, your parents, for example, scold you too much. What else? You tend to be fearful of being punished. So what happens? Okay, you were not able to resolve it. And when you grow up, you bring with you the fear. You bring with you the panic. Okay, so yeah. Also your dependence versus independence. Okay, so sometimes lack of independence is caused by the inability of the parents to let the child do things on her own. Okay? Natatakot silang masaktan yung bata kaya hindi pinagluluto. Huwag kang lumabas ng bahay kasi baka masaktan ka. Okay? Don't try this, don't try that. Why? Because you might get hurt. Stop that. So what happens? Okay? Ako na lang ang gagawa. So yung father or mother na lang gagawa. Magsaslice, magluluto, okay, etc. etc. So there becomes a problem with the dependence versus independence. And when the child grows, becomes an adult, okay, the person has difficulty trying new things or learning new things or doing things on her own because she did not develop the independence as a child. So it causes the panic disorder, according to your psychoanalytic theory. Assessment, the objective data, subjective and objective data, signs and symptoms of a panic attack. How do you know that your patient or you are having a panic attack? There is extreme anxiety and fear, a feeling of impending doom. Okay, so we've been using this since kanina. So it is a term used when a person just feels like something bad is going to happen, even when there is no evidence to support it. Okay, so I feel like we are going to die now. I feel like there will be a bomb that's going to drop on us because of the war that's happening in Ukraine now. Okay, there is no evidence to support it. Hindi naman tayo kasama dun sa gera. Bakit magkakaroon ng bomba sa Philippines, for example, or sa Baguio? Okay, so there is a feeling of dread. Okay, takot na takot siya. Okay, so that is your feeling of impending doom. Again, these are realistic thoughts. Okay, within the head, it is real. So, the signs and symptoms. If the brain is thinking it, okay, the body will then believe it. Okay, so there will be physical manifestations as well. There will be palpitations. The patient will be breathing heavily. There is chest pains. There will be nausea. Okay. There will be dizziness, chills, and hot flushes. These are the things that we will observe from your patients. The symptoms of your panic attack, according to the illustration, is sweating, dizziness, accelerated heart rate, sensation of smothering. So what is happening? Medyo nagdadry yung lips niya, okay, and mouth niya. There is trembling, chest pain, discomfort, nausea, or abdominal distress. Why? Because your blood flow will be concentrated because there is a trigger and there is a threat to the body. The flight or fight response is triggered. So what happens? Blood flow is restricted in your GI tract and it will be focused more on your vital organs, your brain, your lungs, your heart. Okay? So what happens? Nagkakaroon ng distress in your GI. Okay? That is what is causing your abdominal distress and your nausea. Lack of circulation or lack of blood supply in your GI. Chills or heat sensation. Okay? Feeling dizzy, unsteady, or the person might faint. Fear of losing control or dying. Okay? So yeah, that is your impending doom, feeling of dread and impending doom already. Ways how you can stop it, refocus your attention. Okay, so for example, thinking of different topics. So here in the photo, she is thinking about math, for example, to divert her thoughts, math equations, focusing on taking slow, deep breaths. We will discuss later the nursing interventions. Splash water on your face, go for a walk, or do light exercise. Excuse me. Remind yourself that these feelings aren't dangerous and will pass. Okay, so let's talk about the interventions more. Diagnostics. Okay, again, if we talk about, I don't think I've discussed this with your group yet, but if you talk about diagnostics or diagnosing patients with mental disorder, in this case, panic disorder and anxiety disorders, similar to our hospital and medical illnesses, it is not our nursing responsibility to diagnose if the patient is having a panic disorder or anxiety disorder. Again, ang magda-diagnose are the doctors. The ones who will diagnose are the physicians, okay, psychiatrists, psychologists. Okay, so God's love, it's okay. Today is a holiday. You can log off. I am just recording this video and you will be able to watch the video on YouTube, okay, on your free time. Okay, today is a holiday. That's why you don't have anyone in the group right now. So you can log off already. Okay, so thank you for your attendance. Okay, so go back to DSM-5. Okay, so again, we are not to diagnose, but what do you need to know? The doctor will diagnose, the physician, the psychiatrist and psychologist will diagnose all the mental disorders using a manual of criteria. Okay, this is your DSM, Diagnostic and Statistic Manual, and 5 just tells us what version is being used. So we already have the 5th version, I think, for 2021. I'm not sure when it started. DSM-5 started probably 2018, 2017 siguro ang updated version of DSM. Okay? So basically, it is a manual, okay, that will tell the physicians what are the things I have to look for to be able to say or diagnose this patient with a specific mental disorder. Is this schizophrenia? Is it panic disorder? Okay. Is it Alzheimer's, etc., etc.? Okay. So DSM-5 criteria for panic disorder include the experiencing of recurrent panic attacks with one or more attack followed by at least 1 month of fear of another panic attack. So there is a panic attack and during the interval, okay, there is a severe worry of the next panic attack. Significant maladaptive behavior related to attacks. Okay, so there is maladaptive behavior already because of the panic attack. Hindi na makafunction yung patient, okay, because of worrying about the next panic attack or unable to function properly because of the specific panic attack. A panic attack is an abrupt period of intense fear. Okay, so sabi natin it lasts for about 15 minutes. Okay, accompanied by 4 or more of the following symptoms. So your panic attack plus 4 or more of these following symptoms, okay, will probably lead the doctor to diagnose the patient as having a panic disorder. So a panic attack plus either palpitations, pounding heart, accelerated heart rate, sweating, trembling, or shaking. SOB, a feeling of choking, chest pain or discomfort, nausea, or abdominal distress, feeling dizzy, unsteady, lightheaded, or faint, chills or heat sensation, paresthesia, okay, numbness or tingling sensations, derealization or depersonalization, fear of losing control or going crazy, and the fear of dying. Okay, so the panic attack must be accompanied by at least 4 of this to be diagnosed as a panic disorder. Okay, but again, you don't have to worry because we are not to diagnose. Okay, let's focus on our nursing diagnosis and not the medical diagnosis. Let's focus on our nursing interventions. Okay, and the diagnosis, it is a doctor or physician who will be doing that through, again, the DSM-5. So try to look in Google, how does a DSM-5 look like? Treatment for your panic attacks or panic, we call this panic disorder. Okay, so depending on the theory that was used, okay, or you can have your milieu therapy as well, which is a combination of your milieu theories, milieu therapy, halo-halo. Cognitive or behavioral therapy can be a treatment. Okay, how do you do that? You replace negative thoughts with realistic positive thoughts. So when the nurse is telling the patient to stop thinking about the persons who are going to kill him, okay, that are basically non-existent, okay, replace it with thoughts. Let's talk about your family. Let's talk about what you want to do in the future. Where do you want to travel? Okay, so you redirect the thoughts of the patient into positive thoughts. We always use this in our charting and NCPs, relaxation techniques such as deep breathing, progressive relaxation. So what is progressive relaxation? I will think pag-isipan ko ulit. I forgot what is progressive relaxation. A positive visualization and guided imagery and listening to calming music. Progressive relaxation, if I remember right, okay, it is calming the patient from one stage to another. Okay, so that is Safia Odulio, it's okay. Today is a holiday. I am just recording the video, and then I will be sending you the link for the for this video. Okay, so holiday ngayon kaya
okay po, sir. Good morning po. Thank you po.
Positive visualization and guided imagery and listening to calm music. Okay, so wait a minute. Okay, I just browsed my notes again to remember. Progressive relaxation. Okay, basically when you are having a panic attack, your muscle tenses. Okay, nagte-tense yung mga muscle natin. Okay, progressive relaxation is when you tense your muscles voluntarily. So you are the ones who are tensing your muscles. For example, you tense your chest muscles, you tense your arm muscle, your leg muscle, your abdominal muscles on your own, and then you relax it. So what is happening here is that instead of just your body tensing up its own muscle because as a response to the stress that you are feeling, okay, you learn to control it. It means that I will stress myself, I will tense my muscles on my own, thus being able to relax them on my own as well. Okay, so that is your progressive relaxation. Teaching your patients to tense up their muscles on their own and then relax them one by one as well. So it becomes a cycle. So number one, it helps them to control, okay, their own muscle tensing. Number two, it refocuses them as well. So instead of them focusing on the anxiety trigger, what happens is that they focus on tensing up and relaxing their muscles. Okay, that is your progressive relaxation. Positive visualization and guided imagery. So positive visualization is basically, okay, close your eyes. Okay, let's think about positive thoughts. Let's think about the beach. Where was your favorite beach? Okay, imagine guided imagery. Imagine your feet on the sand as your eyes are closed. Imagine the waves. Okay, you can hear the waves. Imagine yourself holding coconut, okay? Drinking cold coconut by the beach, or drinking beer by the beach, or eating barbecue by the beach. Okay, imagine, for example, your friends and your relatives, okay, swimming and asking you to go to the shore with them to play by the seaside. Okay, so that is your guided imagery. Okay. Listening to calming music. Okay, so some of us have different tastes in music. Okay, but we have to be specific here. So probably mga classical music, mellow music. Okay, we will ask the patient to listen to that. Trigger talk is also a treatment. So what happens in the trigger talk? We talk about the triggers to lessen the power of the trigger to induce the attack. So the anxiety attack is caused by a trigger. For example, dogs or stress or work. Okay? So what happens is we let the patient talk about it. Okay? The more we talk about spiders, for example, okay, the more we learn about spiders, the more we are open about spiders. So what happens is it doesn't trigger as much. So the goal is to lessen the trigger. So sige, let's talk about what happens at home. Let's talk about your father. Okay? So what does he do? Okay, let's talk about the childhood of your father. Saan siya nakatira? Okay? What's the name of your lolo and your lola? Okay? What did your father, what was sort of the favorite things that you remember your father was doing nung bata ka? Okay, so what happens as you continue talking about the father, the patient, okay, every time probably the patient remembers his father, he doesn't only focus on the times that she was punished by the father, pero naalala niya, ayaw nga pala, when I was a kid, my father always brought me cotton candy. Lagi kaming naglalakad sa park. Lagi niya akong hinahatid sa school, because those are the things that you talked about during your conversation. So talk about the triggers, okay, and divert it probably to a positive conversation so that it lessens the power of the trigger to induce a panic attack. Patient teachings about the disorder. So let's talk about what is a panic disorder, what is causing it, okay. What are the signs and symptoms? Okay, so the more you educate your patient about the disease, the more she will understand what is happening to her body, okay, and the less she will be anxious about it. Okay, and hopefully once she understands more about the disease, the panic attacks lessen as well. Okay. Other treatments, of course, will include pharmacologic therapy. Okay, so chemicals, especially if the cause is biochemicals as well. So what are the medications that we use? Anti-anxiety drugs, anxiolytics, benzodiazepines, lorazepam, Ativan, antidepressants. So ito mga lorazepam, it's not that I got addicted to it, but when I was working abroad kasi, it is very easy to go to physicians. Okay, so we call that our MC, a medical certificate or medical leave. So abroad, I was working with individuals with mental disorders as well. And sometimes it becomes stressful. So if I don't want to go to work, okay, I have to go to a physician and ask him. Okay, so I don't want to go to work today because I've been feeling stressed, feeling tired at work, okay, attending to kids with autism, attending to kids na nagwawala. Okay, so it becomes stressful. I tell also the doctor that I miss my family at home. Okay, so I talk to the doctor about that. So what happens is he will prescribe to me lorazepam for about 3 days so I can rest. I can de-stress. Okay, it is a bit addictive. Okay, it will become, kasi ma-addict ka sa feeling of you will be relaxed. Ang sarap ng tulog mo, ang sarap ng gising mo. Okay, so when I was taking lorazepam, okay, tawag dito, you will understand that ganito pala yung reason why other people become addicted to medications. Okay, so what happened is when I started taking lorazepam, okay, minsan na-excite akong mag-absent sa work. Okay, because I know that kung kailangan ko mag-absent sa work or mag-sick leave or medical leave, okay, it's not that I only hindi lang ako mas-stress sa work, okay, makakakuha pa ako ng lorazepam. Okay, but it's something that I didn't do naman occasionally. Okay, so for example, every 3 months when I needed to just relax and rest from the stress of work. Okay, so and plus it is prescribed, so limited lang yung binibigay sa amin na lorazepam nung doctor. So good for 2 days, good for 3 days already. And the doctor knew that I was a nurse also, kaya hindi siya worried, okay, na I would be dependent on it. Tsaka mahirap makakuha ng over-the-counter na anxiolytics. So, yeah. But it's really something. For example, when you have headaches, okay, effective talaga ang paracetamol, mga tipong ganun. Okay, so once you try pharmacologic therapy rin, it really works din talaga. It calms your body, it calms your mind. Okay, so that's why it becomes probably addictive to others. Let's look at the picture for stress relief. Just take a deep breath. Start the week calm with 4 deep breathing techniques. So start the day as well, especially that today is a holiday. What can you do? Okay, belly breathing. Slowly fill your empty. Slowly fill and empty your belly with breath. So inhale and exhale, and see your chest and your body and your abdomen rise. Okay, so that is your mindful breathing. Breath count. Count your breath slowly and evenly. Okay, also count how long you are holding your breath in. Not too long so that it doesn't cause tension in your body. Okay, so inhale for 2 counts, exhale for 2 counts. So that is your mindfulness breathing. Pay attention to the rhythm of your breath as well. Not too fast, not too slow. And breathing visualization. Visualize taking in something positive with each breath. So inhale positivity, inhale the fresh air, mga tipong ganyan yung iniisip mo. So ito rin yung mga tinuturo mo sa patient mo, your deep breathing and relaxation. So these are the things that you would like to talk to him. These are the things that you would like to break down regarding deep breathing and mindful breathing. And this really is relaxing. If you look at saan ko ba natutunan to? Yoga. Okay, so most of us have tried yoga already, and this is the introduction to yoga, the breathing, di ba? Even of how you hold your nostrils. Paano ba yung sa ano? Parang 2 fingers yata. Okay, you use 1 finger to inhale. You close 1 finger. You use the other finger to close the other nostril, then exhale. So that is your mindful breathing in yoga. So inhale. Exhale slowly. So it calms the body and it prepares the body for yoga. That is your mindfulness breathing. So try this mindfulness breathing early in the morning before you go to school. Okay. Usually kasi when you wake up in the morning, stressed ka na about preparing for school, preparing for duty. So try to take your deep breathing techniques muna. Para pagdating mo rin sa hospital and sa psych ward, alam mo paano turuan yung patient mo mag-deep breathing. So yung belly breathing, breath count, mindful breathing, and breathing visualization. Nursing interventions, very important. What are your nursing intervention disorder or an anxiety disorder? Okay, so this is divided into during the panic attack and in between panic attacks, because if we talk about panic disorders, remember it is a panic, and then after the panic, okay, it is worrying about the next attack. Okay, so what are we going to do? During the panic attack, stay with the patient until the attack subside. Okay, so samahan mo yung pasyente mo. Let him feel, let her feel that you are there and that you are concerned for her. Why? Because if the patient is left alone, the patient may grow more anxious. She may not know what to do. She needs someone to guide him. Okay, or make her feel protected during the panic attack. So stay with your patient. If the patient continues to lose control, guide the patient to a smaller or quieter area. Okay, so it seems that you are having the panic attack is starting to intensify. Okay, so try to relax. I will bring you to your room, or let's walk first to the padded area, or let's walk first to your bed, okay, or sit down on the couch. Okay, so instruct the patient and assist the patient, okay, into a quieter area. Of course, if the other patients are noisy, it will further trigger confusion and anxiety. So bring your patient to a quieter area. Instruct the patient to take slow, deep breaths. So deep breathing exercises natin that we just did. Maintain a calm, serene approach. Okay, so if your patient is having a panic attack, ikaw as a nurse provider or a care provider, huwag ka magpanic. Okay, you should be calm. Okay, and focus on calming the situation as well. Anxiety is contagious and can be transferred to another client or even to another healthcare worker. So stay calm. Okay. We don't want another patient worrying or having a panic attack. We don't need another nurse who will become hysterical. Hala, nagwawala na naman yung pasyente. Anxious na naman siya. Okay, so calm down. Okay. Remember, this can last up to 15 minutes. So the client needs you to be calm as well for her. Speak in short, simple sentences. Okay, so there is also your tone of voice. Use a low tone, not a high tone, because a high tone can be irritating. Fast talking can be irritating as well. Fast tone can cause more anxiety. It can be a trigger. Okay, so one direction at a time, less words, okay, so that the patient can understand you. In autism, in treating patients with autism, we call this low, slow, and show. So talk in a low tone, talk slowly, okay, and show. Show by pointing, for example. Okay, let's go to your bed first. Let's go to the couch. Okay, so ituro mo. Lead the patient to the couch, lead the patient to the room. Reduce external stimuli, turn off the radios. Okay, stay away from the other noisy patients. Provide a safe environment and prevent harm to and from other patients. Remember, this is a situation that can be a trigger. Okay, so what happens if your patient is having a panic attack? Pwedeng matrigger din yung other patients. Okay, so if other patients are violent, okay, or having delusions, nasisiraan na ng ulo, o sinasaniba na siya ni Satan, what will happen? They can start hitting a panic attack. Okay, so isolate, separate to prevent harm from the patient. Prevent harm to other patients. This person who is having a panic attack can start hitting other patients or other nurses as well. Okay, so try to separate them from other patients and other staff, unnecessary staff. Encourage the patient to express his or her feelings. And if necessary, kung gusto niyang umiyak, let the patient cry. Okay? To be able to alleviate the stress and the tension and express her feelings. Also, your nursing intervention is administer medication as prescribed. Lalo pag hindi nawawala yung panic attack. Okay, we might need to give your IM anxiolytics already as prescribed by your doctor. Kung walang prescribed and you think that the panic attack is not stopping, of course, okay, inform the doctor. Inform the doctor na masyado na matagal yung panic attack and there is no prescribed medications. Okay? So dapat mag-order yung doctor by phone or by writing. Baka pupunta yung doctor sa ward. Like same as you see in our hospital duties. Other nursing interventions. Kanina, we discussed the during. And as we said, a panic attack, worry about the next panic attack. So what happens? Another nursing intervention between panic attacks. So you can see here the patients are more conversant already. Okay, probably in between or after the panic attack. Okay, this is the time we teach relaxation techniques. Okay, so during your next panic attack or while you are worrying about the next panic attack, okay, we'll do deep breathing. We'll talk about imagery. We'll talk about learning to control your muscles. Okay, so dito it is in between the panic attacks that your patient is teachable. Okay, so most of the educatives, this is when we do. During or between the panic attacks, we also determine the primary trigger. Okay, what do you think triggered the panic attack? Okay, is it because of the environment? Is it because of you were focusing on it too much? You were anticipating that you were going to have a panic attack. Yun na lang yung laman ng isip mo. Kaya na-trigger. What else? The noise of the other patients, or thinking about the relatives or the parents or the mother or the children. Iniisip ko yung wife ko. Kaya baka hindi sila okay na nandito ako sa rehab tapos sila nasa bahay nila. Nakakakain ba sila? Okay, are they being protected, etc., etc. Okay, so determine the primary trigger. You can also have secondary triggers like caffeine. Okay, so inom ng kape kaya nagpanic attack, or puyat, the patient was not able to sleep. Okay, kaya nagkaroon ng panic attack. So those are your secondary possible causes. Help the patient identify the situation that caused the attack. So again, primary or secondary. Situation, trigger. Okay. Encourage the patient to discuss fears and concerns about the panic attack, about the thoughts. What else? Ask questions to clarify and dispute illogical thinking. So we are going to challenge already. Remember, these panic attacks are illogical. There is no proof that they will happen, the threat will happen. So we have to present reality to the patient. If the patient thinks that he is going to die, and that there are people who are going to kill him by Duterte. Okay, some questions that can cause him to think. Again, we are stimulating him to think, and we are not just challenging him. We are not dismissing his thoughts and concerns. We do not want him to feel humiliated. Okay, so we will just ask for the purpose of conversation, for the purpose that he will stimulate his thinking. What evidence do you have that Duterte is going to kill you? Okay, what are the evidence? Sinabihan ka ba mismo, face to face, by Duterte, that ako, papatayin kita? Harap-harapan ba sinabi sa ni Duterte? Did Duterte send you a note, for example? Did Duterte send you a text message? Okay, have you talked to him on the phone? Okay, so hopefully this question, he will try to figure out, ay, oo nga, no? What are the evidences I have? Okay, so it will help him distinguish reality from imagination. Okay, so ask also your patient, explain the logic in that. Okay, so explain mo, bakit sa tingin mo may ninja dito sa Pilipinas na gustong pumatay sa'yo? Where is the logic in that? Why would a ninja go to the Philippines? Explain the logic. Okay, so how can a ninja that does not exist already in the present times come, okay, into our facility, okay, to threaten you? Okay, so try to explain the logic in that. Explain the logic in aliens, for example. Okay, so paano sa tingin mo? Will the aliens come inside? That conclusion from a fact or a feeling? Okay, nararamdaman mo lang ba, or do you have proof? Do you have personal experiences, for example? So pag sinabi niya, for example, the thought is that my father will kill me or my boyfriend will kill me. Okay, are you basing that on fact or feeling? Okay, pag sinabi niya there has been a history. Okay, so nakikita mo ba tong scar na to? Ito, hinampas ako ng boyfriend ko niya ng baseball bat. Okay, so kung meron, may previous mga proof. Okay, so that is more realistic. But if it is something that never happened, there is no history of the father hurting her, the boyfriend hurting her, okay, it can be a feeling only. And so that will be something that you will point out with your patient. Okay, one of the therapeutic questions is, what is the worst thing that can happen? Okay, so we are now in a psych institute. For example, we are in a rehab facility. What is the worst thing that can happen? How? Okay, so the worst thing that can happen is, for example, another patient will kill me. Another patient can harm me. Okay, then you present the reality of the situation. That's why we have nursing attendants. That's why we have nurses here. That's why we have doctors, to make sure that other patients will not hurt other patients as well. Okay, so it is the patient being able to verbalize her concerns, and the nurse presenting reality. Okay? Thus hoping that once the patient understands the reality, mabawasan yung iniisip na worry. Discuss alternative coping mechanisms such as use of positive talk. Okay, what is positive talk? I can control my anxiety. Okay, I am stronger than this. I will get over this. Okay, so identifying who? Okay, I, the patient. And what can I do? I can control this. I will become better. Okay, I will stop my anxiety from controlling me. These are things that are not real. Okay? I love myself. I love my family. I want to go to the beach someday. So these are positive self-talk. Monitor therapeutic and adverse effects of the medication. Okay, so since you are giving medications, you have to monitor if the medications are improving the patient. Okay, if the patients are causing what side effects to the patient, if adjustments have to be made. So monitor therapeutic and adverse effects of the medication. Okay, so that is your anxiety disorder. We are now going to talk about your generalized case. This will be the second disease that we will be talking for today. Occasionally, anxiety is a normal part of life. Okay, so it is when you feel a pressure, okay, to do something. Okay, so to move, to be able to solve a problem. So it is a normal part of life. However, with GAD or generalized anxiety disorder, the anxiety and worry is persistent, generalized, and excessive. Okay? The effects of GAD range from mild to severe to incapacitating. So the anxiety can be mild, just like what we discussed, the levels of anxiety. Okay, the normal to the healthy level, but it can be up to the incapacitating. So hindi na makagalaw, hindi na makafunction. The patient cannot function. The patient cannot do ADLs already because of the severe nervousness or anxiety. To relieve anxiety, many with GAD self-medicate. Okay, when you talk about self-medicate, it was not prescribed by the doctor. Okay, they either self-medicate with what? Anti-anxiety drugs, if they're able to get drugs illegally or get the drugs in ways they can, they will self-medicate. Or if they cannot, they will use alcohol because alcohol is a depressant. Alcohol will help them sleep as well. So pag worried sila, I take alcohol, okay, I eventually am able to sleep. That's why they become alcohol dependent. Before I continue with generalized anxiety disorders, my slides, okay, let's go first to a GAD video.
Maybe right before the exam? Well, this is completely normal and might even be useful in some situations because it can make you more back and breathe aside for some people, and at this point that get worse over time and cause things to the home. An anxiety disorder. No one particular type of anxiety disorder is generalized anxiety disorder, or GAD. This type is characterized by anxiety about everyday things like money, health, family, work, and relationships. Sometimes even the thought of getting through the day produces anxiety. And it's this anxiety, as opposed to like normal anxiety that everybody feels, has three main pieces. The first is that it's persistent, meaning that it doesn't seem to go away. The second is that it's excessive, so it's usually way more than someone else might have given that situation. And third, it's typically pretty unreasonable, as in there really isn't any reason to worry about whatever you're worrying about. Now, people with GAD might even be aware that these worries are excessive and unreasonable, but they don't know how to stop feeling like this or feel like it's completely beyond their control. Some people with mild GAD might be able to function socially and hold down a job, but others with severe GAD might have trouble with the simplest of daily activities. So what causes one person to have GAD and one person to not have GAD? Ultimately, as is the case with many psychological disorders, we don't know. Genes, though, are thought to play a role, since sometimes it runs in families, and also the environment you're in, especially if high levels of stress are involved. Also, several parts of the brain have been linked to fear and anxiety, and continued research into these areas may provide some clues in the future about GAD. Alright, so how might we know that someone has GAD? What are the signs and symptoms? Well, the main symptom is frequent worry and tension or stress for little to no reason. Other symptoms might include things like edginess or restlessness, or an impaired concentration or feeling like your mind just goes blank. And then also irritability. And these psychological symptoms can even be severe enough to lead to physical symptoms, like difficulty sleeping. And this is one of the biggest physical complaints of people with generalized anxiety disorder. Our bodies need to recharge when we sleep, right? With that said, insomnia can take this serious toll on your physical health, which means your body isn't functioning at its optimal levels, is it? Besides insomnia, though, another physical symptom might be digestive problems. Chronic stress may lead to eating more or less than normal, and many people even experience diarrhea or constipation as a result. And finally, muscle aches and soreness is also a pretty common symptom of GAD. This happens from increased muscle tension, because people with anxiety carry around this tension in their bodies, which can lead to tense shoulders, back, jaws, and muscles, and this can even manifest as clenched jaws or teeth grinding. Overall, these physical and mental symptoms usually come about gradually, typically starting in the teen years or young adulthood, but over time they have this serious impact on your well-being. Additionally, there might be periods where symptoms seem to be worse, or they might get worse during periods of high stress. Unfortunately, there aren't any tests that'll tell you whether you have GAD or not, and a proper diagnosis will be based on a medical professional's questions about your symptoms. So from the Diagnostic and Statistical Manual for Mental Disorders, the 5th edition, or the DSM-5, the following criteria are given for a diagnosis of GAD. Excessive anxiety and worry is present and occurs more often than not for at least 6 months and is clearly excessive. And then the other one is anxiety and worry is associated with at least 3 of the symptoms that we went through, and in children only 1 symptom is needed for a diagnosis. And once it's been diagnosed, we're going to look to treatments, right? And GAD will often be treated with psychotherapy, medication, or both. Specifically, within psychotherapy, we'll often try something called cognitive behavior therapy, which is really useful for treating GAD since it tries to teach you different ways of thinking, behaving, and reacting to situations that reduce your feelings of anxiety and worry. And the other form of treatment is medication, and there are 2 types that are usually focused on, and the first are anti-anxiety medications. These tend to slow down our central nervous system, so our brain, and so they have this kind of like relaxing and calming effect. Typically, anti-anxiety medications are benzodiazepines. Apart from those, though, antidepressants can also be prescribed, and these are approved for depression, but have also been found to be effective for treatment of anxiety as well. The most commonly prescribed antidepressants are selective serotonin reuptake inhibitors, or more commonly just called SSRIs. These guys work to regulate serotonin levels in our brain and elevate your mood. Knowing that these treatments exist, some people respond better to cognitive behavior therapy alone, and some respond better to medications alone, while still others respond best when both are used together. It totally depends on the patient, and so needs to be tailored on a case-by-case basis.
Okay, continuation of our GAD, Generalized Anxiety Disorder. Okay, GAD affects an estimated 3% of the general population, occurring more in women than men. So when it comes to your anxiety disorders, yes, it is more prone to women than in men. The age of onset is in the early 30s, but all age groups, including children up to the elderly, okay, children and elderly are also affected. Usually, GAD emerges slowly and is triggered by a stressful event. Okay, so it can be a death of a relative, illness. Okay. GAD tends to be chronic with periods of exacerbation and remission. So two terms that you will encounter in your psychiatric nursing are your exacerbation and remission. Okay, so exacerbation is when lalala ulit, okay, yung disease. So exacerbation, when you have a disease, you can either get well from it. So for example, the symptoms of schizophrenia, okay, become asymptomatic. Okay, so basically yun yung term. The patient becomes asymptomatic from the psychiatric condition. Okay, so exacerbation is when it becomes severe again. Remission is when it decreases. Okay, so there can be periods of exacerbation and remission. Causes of GAD. Okay, as said in the video as well, and as said in my source, in my book, the exact cause of GAD is unknown. Okay, but we will look at the different theories. Okay, genetic factors. Okay, 1/3 of the risk of experiencing GAD is genetic. So if you have parents who were also diagnosed with generalized anxiety disorder, you have a 33% chance of developing it as well if it runs in your family. You also have your psychosocial and environmental factors. Children of anxious parents may learn to see the world as dangerous and uncontrollable, thus predisposing them to GAD. Okay, so pag masyadong nervyoso, if the parents do not give the child opportunity to explore, the opportunity to try, okay, the opportunity to learn, for example, how to ride the bike, to climb the mountain, to go out and play with the friends in the streets. Sabihin ng parents, no, it is dangerous, baka masagasaan ka, baka masaktan ka. What happens? Okay, the child grows and is unable to try and become independent, thus predisposing them to GAD. Okay, behavioral inhibition. Okay, ayaw payagan, okay, because they are afraid of what can happen. Negative affectivity. Okay, so laging galit yung parents. If the parents are always angry, what happens? The child will not ask permission to go out. Hindi na ako magpapaalam kasi galit naman si mama. Galit si papa. So most likely hindi ako papayagan. So there is a negative affect that also the child can inherit. And harm avoidance. Okay, so don't do that, you might get hurt. Don't do that, you might fall. Don't run too fast, you might stumble. Okay, so all of this has been associated in developing GAD. Okay. Situations also, like death of a loved one, illness, job loss, divorce can either be triggers or causes of GAD. So highly stressful situations. Then stress can further trigger GAD. Biochemical theory tells us that biochemical abnormalities can lead to GAD as well. Imbalances in your serotonin level, norepinephrine, glutamate, and GABA levels, okay, can lead to generalized anxiety disorders. Okay, so what are the causes of anxiety disorders, GAD? According to the Mind Journal, okay, traumatic and stressful life experiences from childhood up to adulthood, okay. Brain structure as well, abnormalities in your brain formation, Brain hormones can cause GID. Drug and alcohol abuse, and genetics. Okay, those are causes of GED. Signs and symptoms. Okay, your signs and symptoms of GID fall into 3 categories. First category is your excessive physiological arousal symptoms. This includes your shortness of breath, tachycardia or palpitations, dry mouth, sweating, cold sweats, nausea and diarrhea, feel of vomiting, loose bowel. Ibig sabihin, the peristalsis is increased because of stress. Your inability to relax or calm down. Muscle tension and spasms. The patient is irritable. Fatigue. Okay, so the patient feels tired because of the tension, mental tension and physical tension that the patient is feeling. And then as you heard in the video, difficulty of sleeping. Hindi ka na nga makatulog, your muscles are stressed, your brain is stressed, your thought is stressed. Okay, so it will really lead to fatigue. Restlessness, trembling, headache, cold, clammy hands, and inability to sleep or insomnia. So these are your excessive physiologic arousal symptoms. Why again? Because the patient is focused on worrying about the next panic, or he is continuously having panic attacks. The second category is your distorted cognitive processes. Okay, so another symptom, poor concentration, unrealistic assessment of problems, excessive anxiety and worry over minor matters, fear of grave misfortune or death. No, mamalasin na naman tayo, hindi na naman tayo magiging successful, we won't be able to pass the exams, we won't be able to become rich, okay? Or we are going to die because of a morbid event, there's going to be war, okay? So fear of grave misfortune or death. Okay. The last category is your poor coping. Signs and symptoms, poor coping. There is avoidance. Avoidance of people, avoidance of stressful situation. Ayaw nang mag-work, ayaw nang mag-interact with other people. Procrastination is just not attending to the activities that need to be done. The patient doesn't want to go to the doctor. The patient doesn't want to take medication. The patient just stays in bed and does not want to go out. Okay, doesn't want to do anything. So procrastination. And there is poor problem solving skills. Okay, because of the narrowed focus. What happens now, instead of solving and dealing with the problems, she is just focused on the problem itself. Okay, the fear or the dread that the patient is feeling. Okay, diagnosis. Again, generalized anxiety disorder is characterized by excessive worrying lasting more than 6 months. So chronic. Okay? It significantly impairs the ability to function, okay, because you are preoccupied with worrying. Okay, so there is inability to function in his personal life or even in the social life. Of course, inability to work. When you talk about personal life, inability to do ADLs, okay, hygiene probably, eat properly, hindi niya rin magawa, cook for himself, clean his own room or the house, okay. Also attend to the family. So all of this is affected by the disorder. The diagnosis, again, we focus on DSM-5, Diagnostic and Statistical Manual, version 5. Okay, who does the diagnosis? Who will say that the person is having GID? Okay, of course, the doctor, your psychiatrist, your psychologist, okay, and the attending doctor based on the DSM-5. DSM-5 criteria for generalized anxiety disorder. What are the things that the doctor will look and assess on the patient to make sure that to say that he is having GAD? Okay, there is excessive anxiety and worry. Apprehensive expectations occurring more days than not for at least 6 months. So within 6 months, it doesn't mean every day, okay? But more days in those 6 months. Majority of the 6 months, ilang days yun? In the 180 days, he spent a lot of days worrying and being apprehensive and waiting for an impending doom, worrying. Okay? About a number of events of activities such as work and school performance. Okay, so he spends a lot of time worrying about events that can happen in the life. The individual finds it difficult to control the worry. Okay, unlike us, pag sinabi natin, hayaan mo na nga yan, hayaan mo na yung pasyente na yan, or hayaan mo na yung project na yan, hayaan mo na yung requirement, hayaan mo na yung module, you can actually pause to forget about it and focus on another task that you would like to do. Like watch a Korean novela, for example, watch Netflix, or play your video game. But for them, they cannot divert their attention very easily, okay, from what is bothering them, from the problem that they are thinking and what they are worrying about. They can snap out of it. The anxiety and worry are associated with 3 or more of the following symptoms. Okay, so plus 3. So excessive anxiety and worry, difficulty to control the worry, plus at least 3 of the following. The patient is either restless or feeling keyed up or on the edge, laging stressed. Okay? Being easily fatigued, difficulty concentrating or mind going blank, irritability, muscle tension, and sleep disturbance. So any of those 3, plus the first 2, which is excessive anxiety and worry, difficulty to control the worry, okay? The physician, the doctors, the psychologist, or the psychiatrist can already diagnose the patient as having GAD. Okay? Not the nurse. This is not a function of the nurse, but the nurse should know it as well. If you're able to diagnose, what then are the treatments depending on the therapy or the mode, okay, or the theory that we are using? For cognitive therapy, reduces cognitive distortions by teaching the patient how to restructure his thoughts and view worries more realistically. So you can either structure it. Okay, if you are worrying about school, what is it about school? Okay, is it about your relationship with the clinical instructor? Natatakot ka dun sa clinical instructor? Okay, so let him break it down. What is it about school that you are worried about? Is it the tuition fee? Is it the payment? Is it about the cases? Okay, so structuring can help you narrow down what is it about the specific topic that you are worried about. If you're worried about school, is it because of the duty? Ayaw mo mag-duty, ayaw mo magkasakit, ayaw mo mag-uwi ng sakit sa magulang mo because your parents or your lola is already old. Baka pag uwi ko, may dala akong virus, kaya ayaw ko mag-duty. So, it helps you focus on what is the problem is. Thus, you can be able to target specific solutions already. A worry ledger is also advised. What is that? The patient is taught to record worries. Okay, so ililista mo lahat ng nagkukos ng pag-alala mo. So ilagay mo dito sa small notebook. Okay? Then not just the worry, but you will also list evidences, okay, to justify or contradict. Okay, if I'm worrying about Duterte coming here, so write the evidence. Sulat mo dyan yung mga evidence na pupuntahan ka ni Duterte. Okay, kasi may sinabi akong ganito sa social media. Okay, what will contradict? Nag-reply ba siya? Was there someone who bashed you? Okay, did the Presidential Security Group, for example, contact you? Did the NBI go to contact you already? Did police come to contact you about what you said or what you did? Okay, so even if what you said was insulting, okay, we have evidence that, for example, Duterte really was able to read your message. The patient also learns to avoid worrying about worrying. Remember what is happening now in between the after the panic attacks or during the anxiety, the patient tries to worry about when will be the next panic attack, what will be my feeling, where will it happen, what time will it happen. So yun yung mga iniisip niya. Okay, so that is worrying about worrying. So let's let the patient divert his attention instead of thinking about the next panic attack. Avoidance, okay, also the patient will learn that avoidance and procrastination are ineffective coping techniques. Okay, you cannot do avoidance and procrastination because it will not solve the problem. What will solve the problem is you going to the doctor. What will solve the problem is you following the advice of us nurses. What will help solve the problem is you developing relaxing techniques, behavioral cognitive techniques that will help you battle the anxiety disorder. Okay. Another treatment will of course be pharmacologic therapy, medicines. Drugs may be considered if anxiety significantly impairs the daily functioning. Okay, he's not able to work already, unable to attend to himself already because of the anxiety. So the doctor will prescribe medications such as anti-anxiety agents, benzodiazepines, lorazepam, clonazepam, diazepam, and clonazepam. Okay, it is relaxing medication. It is what they call this. Yeah, it is basically stress relieving. Okay, and it relaxes not only your mind but also your muscles. SSRI and SNRI, paroxetine, sertraline, and fluoxetine. Okay, so Prozac and Zoloft are two medications that you will encounter frequently in your exams, okay, regarding psychotherapy or psychiatric nursing. Yung Zoloft, Prozac, lorazepam, okay, clonazepam, lalabas na palagi yung mga yan. Your anti-anxiety medications. Okay, also another treatment for generalized anxiety disorder is biofeedback training. Okay, in biofeedback training, the patient learns to identify his vital signs. Okay, tumataas na ba yung BP ko? Okay, tumataas na ba yung heartbeat ko, yung heart rate ko? I can feel my heartbeat beating fast. I can feel I am breathing fast already. So once the patient is taught to identify that these are symptoms of him having a panic attack already, he can learn to control them as well. So, ay nako, ang bilis na ng paghinga ko. Okay, I will try to breathe slowly. I will try to breathe, do deep breathing exercises. I will try to do my counting. Else, I will try to relax my muscles that are tensing up so that my vital signs will become lower. Okay, so that is your biofeedback training, because again, it is a feedback. You will the vital signs are influenced by the trigger. Okay, the vital signs are rising because of the anxiety. Okay, and sometimes if we are able to identify the symptoms, I let him identify his vital signs, he will be able to lessen, okay, his breathing, relax himself, okay, because he can see that there are signs already that he is having a panic attack. Same like our progressive training earlier, okay, relaxing the muscles. Yeah. That is your biofeedback training. Generalized anxiety disorders. Of course, you have your nursing interventions. What else can you do as nurses to help your patients while he or she is anxious? Remain calm and non-judgmental. Don't judge him about what is causing the trigger. Okay, ikaw naman, ninja na naman, mga tipong ganun. Okay, si Duterte na naman ang iniisip mo. Okay, so remember, if it is in his mind, if he is thinking it, he is really thinking that it is reality. Kaya nga the body is believing it. So try to be non-judgmental. What else can we do? Suggest activities that distract the individual from the anxiety symptoms. Okay, so if the patient can function, sir, gusto niya ba mag-ping-pong muna tayo para makalimutan mo yung iniisip mo? Let's play cards, for example. Laro tayo ng pusoy, laro tayo ng unggoy-unggoy. Okay, so it focuses him to focus on the cards. Board games, Monopoly, okay, dominoes. Okay, these are the things that can divert the patient. Let's walk in the garden. Let's play with the dogs. Yan yung maganda. Encourage the patient to discuss feelings. What are you feeling now? Okay, what is causing it? What can be the possible trigger? Okay. Reduce environmental stimuli. the lesser the environmental stimuli, the lesser anxious the patient can be, the lesser the distracted the patient can be, the lesser the triggered the patient can be. Stress busting strategies, your educatives. Teach the patient progressive muscle relaxation. Tense up the muscles on your own instead of the body doing it because as a reaction to the stress, fight or flight. Okay, parang ikaw na mismo siya na mismo yung nagte-tense up sa muscle niya and nagre-relax. Guided imagery, thinking about hiking the mountains, watching the sunsets, counting stars, waiting for shooting stars and making a wish. Deep breathing, relaxation techniques, mindfulness breathing. Provide nutritional counseling to reduce stress and promote health. Okay, because the patient is unable to attend to himself already and focuses too much on the problem, most likely he or she is not eating healthy or properly already. So provide counseling. Okay, eat properly. Most of us, di ba, pag gutom tayo, what happens? The way we function is really not good also kasi we don't have adequate source of sugar, okay, or energy in our body. So most likely kaya hindi rin nagko-function or nag-iisip ng tama yung pasyente is hindi na siya nakakakain. It worsens further his condition. So provide nutrition counseling. Avoid caffeine, energy drinks, alcohol, and have a well-balanced diet. Okay, this will help the patient manage the GAD. Instruct the patient in time management skills such as making list. Gawa tayo ng list ng mga gusto mong goals, things that you want to do, things that you have to do to avoid procrastination, okay, things that you are thinking of, things that you will do if you are thinking of negative thoughts. Okay, list them down so that if you are thinking of negative thoughts already, just get the list and try to read it to yourself. Set realistic goals. Also, group task. Okay, ibig sabihin, put the task together and do activities in batches to minimize anxiety. So while you are in the kitchen, okay, this is where you do the cooking. Pag natapos mo magluto, kumain ka na doon. Okay, what else can you do in the kitchen? After cleaning, after eating, cooking, you can clean the kitchen already so that you're not stressed about the kalat. Do your dishwashing, for example. Yan, yung mga making a list and doing things in batches depending on where the patient is. Make appropriate referrals to other members of the mental health team. Let the doctor know, for example, that the patient is having frequent panic attacks. Let the physical therapist know that when the patient is doing art therapy, okay, he is alleviated from the symptoms. Or talk to the occupational therapist about games. Okay, so games that will help the patient improve, okay, his physical activity. Okay, so talk to the other members of the health team. For medication, since your patients can be taking medications, okay, administer prescribed anti-anxiety medications as ordered. Inform the patient and the family of possible adverse reactions. Okay, so adverse reactions can be drowsiness, fatigue. Ataxia is basically uncontrolled or involuntary muscle movements of the arms, extremities, your legs. These are side effects. Blurred vision, slurred speech, tremors, hypotension. So we have to be able to monitor these things observed in our patient. We also have to explain to the patient, okay, na hindi ka nasisiraan ng ulo, hindi ka basta-basta, hindi ka kinokontrol ng alien. Okay, these are side effects of your medication, especially in terms of ataxia. Advise the patient not to discontinue the medication without doctor's proper approval. Okay, so there will be another video uploaded, anxiety disorders and generalized anxiety disorders. Thank you. Enjoy your holiday and please wait and stand by for the notes and the succeeding videos.